सब्सक्राइब कीजिए दिनेश सोलुंके चैनल को, बेल आइकॉन का बटन दबाइए सबसे पहले लेटेस्ट वीडियोस के लिए।
My name is Dr. Deepak Shinde. I am consultant cardiologist working at Kohinoor Hospital, which is at Kurla West, tertiary care, a very high class setup. And today I am going to talk about how to have a healthy heart and a healthy long life. Now why this talk? This talk is because, as you are aware, our India has maximum number of death rates occurring are because of the heart attacks. And that's what is there. And that has been there for years together. For last so many years, it is number one cause of the deaths in India. And the deaths occur in the people who are of the productive age from 30 to further. Beyond 30 people start getting heart attack. Nowadays you can see it at 20 also. And unless we take any major intervention on this is going to be like that for years together further also. So if it is so, what can we do about it? That's what we are going to discover in this Facebook live chat. So, as we know, we as Indians have genetic tendency. So wherever we are, if you are Indian, even if you are living in US, our genes are such that our body will express the disease of the coronary arteries, called as coronary artery disease, or we call it as atherosclerosis, wherein we form the blockage in the heart arteries and we suffer heart attacks. Now, because of that genetic tendency, we are at more risk, and we are seeing more and more heart attacks in the younger age groups also. The youngest heart attacks you must have heard about. I have a patient who I treated for heart attack only at the age of 14. So that's terrible, that's shocking. Now, because of the genes, if the heart attack is occurring, we can't do anything about it, right? We have to just treat the heart attack when it comes. But there are many things which we definitely can do, and we can definitely prevent heart attack, and we can have a healthy heart, and we can have a healthy long life. Now, how to do that? That's what we are going to have conversation about. Now, what causes heart attack? There are major few things, there are 9 major cardiac risk factors that have been identified. And if you take it simply speaking, if you have to discover in your lives, if you see people around you and you find somebody smoking, somebody who is overweight, and by virtue of having overweight, you have more blood pressure, you have more diabetes, your obesity also is partly because you are not exercising, and you see people living so much of stress because of whatever demands and circumstances of the life. People are under a lot of stress, and if you see these things in your life, you are seeing in day-to-day lives that people are like that around you, and there's no wonder. Apparently healthy man one day gets a major heart attack, and you suddenly hear that he's in the hospital, or sometimes you shockingly he's no more, and then we panic. And people panic, what to do. People come to us having seen somebody, and they want to go through lots of checkups, and then they want to have a consultation done. So first of all, what is not heart pain? People come to us with lots of non-specific symptoms. So I want to clear what is not heart pain. Particularly when you should not panic. So simply speaking, if you have a pain in the chest, many people come with a pain in the chest, and the pain they can localize with one finger point. If you can localize your heart pain or a chest pain with a one finger point, usually it is not a heart pain. If it is just a pricking sensation, it is not heart pain. If it is there only for a few seconds, it is not heart pain. Okay. If the pain is there because of the pressure, or if you move the chest, move the shoulder and arm, there is pain. If pain is there on the local movement, it is not heart pain. Alright? So usually then what is heart pain? Heart pain is like when you have heaviness in the chest, in the left side, on the right side of the chest. If you feel heavy, if you that the chest is choking, there is burning sensation in the chest, pains which are coming on the chest, particularly on exertion, like you are walking or climbing the staircase, doing some exertion and you are feeling heavy in the chest, that's the time you know that this could be heart pain. Alright. Now, usually when there is a heart attack, the pain continues to be there for beyond few minutes, even it goes up to half an hour and 1 hour. If the pain is not subsiding and the pain is there for more than half hour and 1 hour, you need to consult an expert doctor there. Now, you could be having breathlessness, you could be having sweating, and lots of things could be there, but main thing is a pain or pressure in the chest that you come to know, and that could be a heart pain. Now, how to know? What do? We do a battery of tests. First is we do ECG, what is called as electrocardiogram, and having normal ECG, it doesn't certify that you don't have heart pain in the beginning of the chest pain. So we further do a battery of tests in the form of one 2D echo test and a Doppler test called as a sonography of the heart, we call it as 2D echo test. We do cardiac enzyme test. And out of these three, ECG, 2D echo and cardiac enzymes, if either of it is abnormal, then we suspect or we say that there is a heart attack element there. And then we further go for what next. And sometimes you have nothing there. In these three also there is nothing there, and we may like to do, treadmill test, what is called a stress test, to find out the possibility of, lack of blood supply to the heart is there or not. And then based on the reports of the stress test, we decide what next. In looking at the overall patient profile picture, we take a call about whether the patient needs an angiography or not in that situation also. So that's about, how to go about when you have a chest pain, how to identify which is not a heart pain and which is a heart pain, and what all tests you might have to undergo so that you can thoroughly, go through that process of identifying whether there is a heart attack or not. Now, most important thing, having known that you have got a heart attack, within an hour, if you can reach the best of the possible center, that's a golden opportunity. Because even if you have had a heart attack and you reach to the center where you can get the treatment for the heart attack, like it could be in the form of an angioplasty, which is the best possible treatment during heart attack, or sometimes if that facility is not available in the center, we give a thrombolytic medicine in that first golden hour. Within that hour, if you can even give that medicine, the blockage and the damage could be reversed and you can have a damage-free heart. However, what happens in many patients, patients are stuck because of the either traffic, other circumstances. They just ignore, and they do not reach to the center, or they are not guided well. They just, many times there's acidity symptom, people think it's acidity, and they have just ignored their major heart attack. They just are not aware that this acidity could be because of the heart attack. And then they land up late to the hospital, having damaged their heart already. And having a weak heart will have consequences. And then it will take a time to heart, even if you do interventions in that phase, interventions are helpful. We might do angioplasties and bypass based on the detailed investigation of the patient, and you still may be left out with a weak heart. Having told all these things, major message I want to convey to you all is that please reach to the doctor, expert in an first hour of the heart attack. Whenever you start having symptoms, please go to the expert, go through that process and get yourself checked such that you can have an intact heart, which is fully functioning normal heart. Now, having all this knowledge, will definitely, I'm sure, will help you to reach to the, expert care. And after that also, what I see, patients who have undergone all these procedures, who have undergone angioplasties, undergone bypass operations sometimes, they need to be on long-term medications. They need to be regularly checking with the doctors. They need to be under follow-up. They need to be controlling their sugar. They need to be reducing their weight, and they need to be really exercising, doing all that what is necessary for prevention of the further blockage, because the blockages and the heart attack that are because of the lifestyle. And we need to really work on the lifestyle, and majority of the people really work hard such that their lifestyle is prevented. Few of them still struggle and they keep on suffering then re-blockages and re-attacks because having not worked on the major thing, that is their lifestyle, which has caused a heart attack. And we see the patient suffering and then they living a life which is not of great quality. So the intention is basically to live a healthy long life. You need to be regular in the form of medications. All that is required to control your weight such that you do diet, exercise, and also a stress management. The stress, living a happy, peaceful and a fulfilled life, no matter what circumstances are there around you, will definitely give you a stress-free life. A happy life is one of the most important things, such that you can have a healthy, long life. So thank you very much. I hope you have enjoyed this video. If you have any comments or any questions, you can definitely ask on. Have a wonderful day and have a healthy heart and a healthy long life. Thank you very much.